Hey guys, today I'm going to be teaching you about Tourette syndrome, also referred to as TS. Today I'm just going to be teaching you about the causes, diagnosis, treatment, and further research that is done every day. So the most important question, what is Tourette syndrome? As defined by Mayo Clinic, Tourette syndrome is a disorder that involves repetitive movements or unwanted sounds, also called tics, that can't be easily controlled. Many individuals with TS also experience neurobehavioral problems such as inattention, hyperactivity, and attention deficit hyperactivity disorder, also known as ADHD. People with TS have also reported problems with mental health disorders such as anxiety, depression, among other issues affecting their daily lives. Big question that people ask when they learn about Tourette's disorder is what are the tics that people usually go through? These tics typically show up between the ages of 2 and 15, but the average is 6 years of age. There's a wide range of these tics, and they are separated into two main groups, which are simple tics and complex tics. Simple tics are sudden, brief, and repetitive movements that involve a limited number of muscle groups, while complex tics are distinct, coordinated patterns of movement involving several muscle groups. These tics can either be motor or vocal, with a diverse spectrum of possible body movements or other vocal inflections. Some examples of tics are twitching, coprolalia, which is using vulgar, obscene, or swear words, or hopping. Before these tics occur, an uncomfortable bodily sensation is experienced, such as an itch, tingle, or tension, called a premonitory urge. Expression of the tic will bring relief from this urge. So another important thing to know about TS is the history behind it. This disorder is named for Dr. Georges Gilles de la Tourette, the pioneering French neurologist who in 1885 first described the condition. Tourette syndrome was initially considered to be a psychological one, but Gilles de la Tourette studied with Jean-Martin Charcot, one of the most important and influential neurologists of his day, to try and debunk what TS was and what caused it. The work of these two amazing neurologists led to the diagnosis of TS. Nowadays, there is no blood, laboratory, or imaging testing needed for diagnosis. The doctor will verify the patient has had both motor or vocal tics for at least 1 year and work from there. Doctors will look at a patient's risk factors of TS while diagnosing them. Two of the biggest risk factors of TS include family and sex. Males are more likely to get this disorder and will express more tics and motor symptoms, while females are more likely to have obsessive-compulsive symptoms. Other studies have shown that TS is an inherited disorder that you can get from your parents, and doctors will also look at that to diagnose a patient. So what is the treatment for TS? Treatment for TS is difficult to do because it is so complex, has such a wide variety of symptoms, and most of these symptoms do not cause impairment. Effective medications are available for those whose symptoms interfere with their daily functioning. These medications are called neuroleptics, which are drugs that are used to treat psychotic and non-psychotic disorders, and are used for tic suppression. Some of these include haloperidol and pimozide. Other behavioral therapies that are used less often are biofeedback and supportive therapy, but these have not shown to reduce tics, but just aid in the patient's everyday life dealing with TS. With a disorder as misunderstood and complex as TS is, research happens every day all over the world. Within the federal government, the National Institute of Neurological Disorders and Stroke, and part of the National Institutes of Health, is responsible for supporting and conducting research on the brain and nervous system every day. A variety of different kinds of studies across a number of medical and scientific areas, including genetics, neuroimaging, neuropathology, clinical trials, epidemiology, neurophysiology, neuroimmunology, and diagnostic clinical science. All of these areas work together to bring new, helpful information and shed light on TS and how it affects people daily. All of these studies done bring us closer and closer to discovering new ways to cope and treat TS to benefit the lives of everyone struggling with it. And here are just some interesting facts about TS that you might want to know. The Center for Disease Control and Prevention, also known as the CDC, study found that 1 of every 360 children, 6 to 17 years of age in the United States, have been diagnosed with TS. This is about 138 children, and so many children and adults go undiagnosed every year. No two people with TS will have the same tics. Each person with TS is as different as every snowflake. A misconception is that people can learn to stop their tics. They can at times hold them in, also known as suppression, but eventually have to release them. Holding them in often results in tension and or physical exhaustion. And the last important fact is knowledge, education, and understanding are very important for people with TS. Educating the patient, family, school, and community are key in the treatment of TS. And these are just the works cited throughout my paper and this presentation. You can visit any of these websites to learn more about Tourette's and educate yourself to further help the people struggling with this disorder every single day. I hope this presentation helps you to understand more about Tourette syndrome, and I hope you continue your search on knowing more about this complex and misunderstood syndrome. Thanks.